The question I get a lot is, can I fix my fatigue with a medication, or is there a medicine that can cure my chronic fatigue? The short answer is, well, yes, there is, but also no, because you were looking for a real fix, right? And you're looking for something that works long term, not just a band aid. In this video, I'm going to share with you the way to get the best results to overcome your chronic fatigue. Now, unfortunately, the necessary long answer is what I have to give you because we're not looking at quick fixes. I'm going to share with you and give you results that are statistically superior than just trying a pill from your doctor. I will explain the exact reasons why I'm sharing my experience, because I've got 20 years experience and patients consistently experience positive results with looking at the big picture. To help you understand what I'm talking about and how to fix your fatigue with a medication, I need to explore 3 parts to help you with that solution. So first question that we're going to explore is, what's the current treatment options offered by the medical system in 2025? So what's there right now? And secondly, why is it not a real solution to fixing the chronic fatigue, and why you will almost feel worse in a year or 2 after trying that? Thirdly, how can you fix your fatigue successfully with a bigger picture approach? Now, if you are really here wanting real solutions to your fatigue problems, it could be tempting to just jump ahead to my third point. But I encourage you to please watch the whole video, as the first 2 points are extremely important and they actually help you with the understanding the deeper reason to how to get your energy back, and they connect to the third part. So let's talk about the first point. What are the medications offered by the medical system currently? So since chronic fatigue is officially not clearly understood by the medical system, it's complicated for them. They don't really have tools to specifically address with one pill. So they don't have specific medications available, so they use different medicines to trial. I'll give you an example. Let's say you have high blood pressure. There are medicines definitely for that they change the fluid levels in your blood, or they change the muscle contractions, which directly reduce blood pressure in your body. But chronic fatigue, on the other hand, it's not one system. And patients don't just have one thing to fix. So the thing is fatigue, but there's also other things contributing to that. So currently doctors might prescribe stimulants like modafinil or methylphenidate, but they make things worse in the long run. They're stimulants. You might have already tried adding cups of coffee or caffeine pills, and it only works for so long before you even feel worse. When your body is screaming out for rest, it's not a good idea just to try and whip it with stimulants and get it going. It would be better to find out why your mitochondria is not producing the energy in the first place. For example, if your car motor was smoking and overheating, you could not drive it down the street and rev the motor. It would just not be a good idea. Like taking it on the freeway and trying to go as fast as you can. You've got to fix the motor. The next medication available that doctors might use is an antidepressant, something like duloxetine or a serotonin reuptake inhibitor. And there are other options, because I'm understanding quite often you're feeling depressed. You're feeling, how do I get over this fatigue? How do I overcome it? So they throw it at you thinking, well, we'll just numb it down, and maybe not feeling this way, you could feel energy in a roundabout way. So that numbing, it just covers it up, the feeling, and it doesn't really give you energy. It might help for a bit, 3 to 6 months sometimes, but patients usually come back and they've got to increase their dosage after 6 months because it just stops working and they feel worse. And then again, this doesn't give you the fuel for your cells. It doesn't fix your digestion, your sleep, your nutritional building blocks that repair your cells in your body. Now, next thing, sometimes doctors tries antivirals. This is less common, but I have heard doctors prescribing them as a trial with patients. So technically, if a patient is struggling with constant cold sores or low immunity, the doctor might feel tempted to address this by giving antivirals because that's in the pharmaceutical toolbox. But it's really like a chicken or the egg. Is the patient having low immunity causing the fatigue, or is the fatigue causing the low immunity? Without a doubt, there's usually low immunity because the whole system is run down. So as discussed in some of my other videos, if you watch those, viruses are often there, but pathogens can be parasites, fungal overloads like Candida, or opportunistic bacteria. So the antivirals are only affecting the viruses, obviously. So next they might try a sleeping pill like Xanax or Valium. This is an attempt to force you to rest. So sometimes patients just can't rest, they feel frazzled, they're not sleeping well, and this is making the chronic fatigue worse. So initially it might work, but generally there's a lot of side effects and patients complain to me they just don't feel themselves. The last medications that doctors might try are anti-inflammatory, like a steroid or a gabapentin or a non-steroidal anti-inflammatory pill. So this is attempting to help the fatigue by reducing the inflammation. So you might not be sleeping because of pain, or you might feel you're feeling pain and not being able to do your activities. These medications definitely don't help your cells produce more energy. They just have side effects often, and they're just calming the inflammation down, which is indirectly not really helping. Unfortunately, all of these medicines are not directly helping chronic fatigue. They're just a band-aid approach, and this is not what you want. I'm sure you're here looking for real solutions. Now, on to our second question. Why is it not the real solution to fixing your chronic fatigue? Why is this one pill not fixing it? The current research on chronic fatigue indicates that it's a complex multi-system illness and patients vary in response to treatments. Research shows that there's almost always a microbiome component to addressing this problem, and this could be something like IBS, bloating, or SIBO, or it could be something more like chronic parasites or severe opportunistic bacterial overgrowth. Research also shows that there is a mitochondria that's that energy center producing in the cells, in case you haven't heard of that, and simply put, that is making that powerhouse work. The function has come to a grinding halt and there's no energy production. This is where we've got to get to. There's also toxicity, diet, nutrition, hormones, and even emotional well-being. None of the medications mentioned in question 1 addresses or fixes these points. Even if you feel better, I know you will walk back into the office in 6 to 12 months, back at square one, or even worse off. Now, this brings us to question 3. How can you fix chronic fatigue with a bigger picture approach? Now, this is what you want. This is, out of doubt, the future medicine way to treat patients. Now, you are a beautiful individual and you have your own unique story and your body picture. Your genetics, your diet, your day-to-day routine, and story of how you got here. It's your story. A one-size-fits-all medicine is not going to fix your chronic fatigue. It requires a plan just for you, and you've got to dig deeper into a fix. It requires addressing the underlying causes. If we don't address those parasites or nutritional deficiencies or mold exposure or dietary inflammatory foods or genetic detox variations like methylation, you will unfortunately keep struggling with fatigue. Now you have taken the first step now and you understand which step to take to overcome your chronic fatigue. Think about your body, which area is the area to focus on. Now the next step is for you to keep learning about your recovery path and put in some actionable steps you can start next. It takes one step after the other. Continue on with the next video and I will see you there. Healing.